While there are many distinct differences between Original Medicare and a Medicare Advantage plan, I want to start off by showing you important things that affect you as an individual when it comes to needing medical care. If you are enrolled in Original Medicare, then you can also enroll in a Medigap plan or a Medicare supplement plan to pay for all of the gaps in copays, in deductibles, and percentages that you're left with from those high out-of-pocket costs. Original Medicare with a Medigap plan also protects you when it comes to needing medical care. If you have a Medicare Advantage plan, you cannot buy a Medigap in addition to Medicare Advantage. Generally, with Original Medicare, you pay 20% out of pocket for Medicare covered services after the deductibles have been met. With Medicare Advantage, most services are covered with a copay. Certain services will require coinsurance of 20% or more on a Medicare Advantage plan. So take a look at this. When you have Original Medicare, you have no out-of-pocket limit. What that means is, let's say for an example, Original Medicare will pay 80% of your medical bills. You are responsible for the remaining 20%. Your 20% has no limit. So if you have a $500,000 bill or $1 million bill, you are going to pay 20% of that. If your bills are even higher, that 20% will always be in the picture. It will never have a cap to protect you from those higher claims. Now, when it comes to your out-of-pocket limit with a Medicare Advantage plan, a Medicare Advantage plan is going to have an out-of-pocket cap. So in that same scenario where you have a $500,000, $1 million bill, or even something as low as a $1,000 bill, a Medicare Advantage plan is going to have an annual out-of-pocket limit, which can range from anywhere between $3,500 all the way up to over $8,000. The difference is with Medicare Advantage, it's going to protect you in those catastrophic events and put that cap on your shared responsibility. Original Medicare will not do that. The second difference between the two is that Original Medicare has no prior authorizations. That means if you need medical tests, surgery, or things done in the hospital or anywhere in between, that service is usually covered and the procedure can happen immediately. Now, the difference is with a Medicare Advantage plan, almost all services have prior authorization. So I'm going to give you a quick real-life scenario. Let's say you go into the hospital with Original Medicare only, you have chest pains. They're going to walk you through all of the tests and procedures immediately to help determine what is wrong. If you have a Medicare Advantage plan in that same scenario and you go in with chest pain, they may have to ask your insurance provider for prior authorization or prior approval before proceeding with the recommended testing. So I cannot emphasize to you enough, Medicare Advantage plans, all of them, are filled with prior authorization requirements which equal delayed care. Original Medicare or Original Medicare with a Medigap plan, they do not have prior authorization. If you have Original Medicare only, you can see roughly 95% of doctors and facilities across the United States. If you have a Medicare Advantage plan, especially an HMO, you are going to be restrained to a much smaller list of providers and hospitals. If you're on a Medicare Advantage PPO plan, you will still be confined to a network. However, PPO networks seem to be a little bit larger. If you have Original Medicare with a Medigap plan, you can still see the 95% plus medical providers in the United States that I originally referenced. Quick recap on those features: no out-of-pocket limit with Original Medicare, out-of-pocket limit with Medicare Advantage, no prior authorization with Original Medicare or Original Medicare with a Medigap plan. Most most, if not all, services require prior authorization on a Medicare Advantage plan, and network on Original Medicare or Original Medicare with Medigap enables you to see roughly 95% of all medical providers in the United States with no referrals. With Medicare Advantage, you are going to be held inside of an HMO or a PPO network, and you will experience referrals. What do most Medicare beneficiaries do when they're faced with having Original Medicare, a Medicare Advantage plan, or Original Medicare with a Medigap plan? I pulled this report from the Kaiser Family Foundation. If you want to read the whole article, I've linked to it in the description below. As you can see, most people opt for a Medicare Advantage plan. This report is a couple years old. Today, I would say closer to 30 million people are enrolled in a Medicare Advantage plan. And if you look at those in traditional Medicare with no other coverage, it is far less, at only around 3 million people total that opt to stick with Original Medicare only. The two most common choices that we see, it's those that enroll in a Medicare Advantage plan versus those that select Original Medicare with a Medigap plan. Original Medicare only is a far lower number of only around 3 million people. So you can see from that information and that data, most people are going to opt for Medicare Advantage or Original Medicare with a Medigap plan. Now, let's talk about some of the differences in the actual premium cost and the actual benefits. So right away, we see that your Original Medicare, your only premium is your monthly Part B premium. Should you pick a Medicare Advantage plan, you still pay that Part B premium and sometimes a separate monthly Medicare Advantage premium. Roughly 70% of beneficiaries nationally are enrolled in a zero premium Medicare Advantage plan. A high number of those individuals are most likely in an HMO Medicare Advantage plan. Now let's take a look at the actual coverage between the two. Again, these are baseline coverages of what services are covered. It doesn't necessarily get into the actual cost that you're responsible for. It's simply showing you that if you go from Original Medicare to Medicare Advantage, you are not losing or giving up any benefits. The Medicare Advantage companies are required to pay at least the same benefits as Original Medicare or more. They cannot offer fewer or lesser benefits than Original Medicare. The actual services that are covered will be the same for outpatient, emergency transportation, emergency room services, lab work, clinical service, diagnostic testing, inpatient hospital care, hospital x-rays, skilled nursing facility care with certain limitations, home health services, durable medical equipment, hospice benefits with certain limitations as well. I would encourage you to visit Medicare.gov to get a complete list of benefits and costs. Now, when it comes to things like private nursing care, routine outpatient screenings, medical care outside of the U.S., Original Medicare and a Medicare Advantage may not cover those things, or they may be extremely limited. Now, one of the selling points that you see in a lot of the Medicare Advantage advertising is going to come in here. When you have Original Medicare, you do not have prescription drug benefits. You would need to also enroll in a separate Part D drug plan. That would be the same if you pick Original Medicare with a Medigap plan. You would also need a Part D prescription drug benefit. If you have Medicare Advantage, most Medicare Advantage plans include prescription drug coverage, and some offer dental and hearing as well. You will not get dental and hearing with Original Medicare or Original Medicare and a Medigap plan. So here's my final thoughts. We work with Medicare beneficiaries all over the country. After 15 years, we've worked with, educated, taught people, enrolled people in thousands of different Medicare plans. Roughly half of people are going to pick a Medicare Advantage plan, and the other half are going to pick Original Medicare with Medigap. What's right for you? We do a needs analysis to help you determine that. You have one camp of people that like the low premium or zero premium, plus the added dental, vision, and prescription benefit that comes with Medicare Advantage. You have another camp of people that would rather pay a monthly premium for a Medicare Supplement Plan G along with Original Medicare because that gives them more comprehensive coverage, far less out-of-pocket cost, no prior authorizations, no referrals, and a much broader selection of doctors and hospitals to choose from. To summarize, Medicare Advantage is less cost per month, but can cost you more as you use it. And again, I cannot emphasize enough how critical it is to be aware of prior authorizations on Medicare Advantage. They can burn you at the wrong time. Medigap is a higher premium like a Cadillac that you want to set it and forget it. You want to go where you want to go. You do not want to deal with prior authorizations. You want the most freedom and flexibility. That would be in a Medigap plan. If you have questions, feel free to comment below. Give us a call. We would be happy to help to do a needs analysis to help determine which avenue might be best for you. Thanks for watching.